The bones of the pectoral girdle are clavicle and scapula, and the clavicle bone, which is also called as collar bone, key bone, or the beauty bone. It is the only long bone that lies horizontally. It is subcutaneous throughout. It is the first bone to start ossifying. It is the only long bone which has two primary centers of ossification, and it has no medullary cavity. Clavicle bone, it consists of two ends, medial end or the sternal end, which is large and quadrilateral, lateral end or the acromial end, which is flattened, and then curved shaft. And the curved shaft which is divisible into medial 2/3 part, which is convex forward, and the lateral 1/3 part, which is concave forward. Lateral 1/3 of the shaft, it consists of two borders and two surfaces: anterior border, posterior border, superior surface, and inferior surface. Medial 2/3 part, it consists of four surfaces: anterior surface, posterior surface, superior surface, and inferior surface. Lateral 1/3 of the shaft of the clavicle, it consists of two borders: anterior border and posterior border. Anterior border is sharp and it is concave forward. Posterior border, it is rounded and convex backward. Superior surface, it is flattened and it is subcutaneous. And the inferior surface, there is a tubercle. The tubercle is corner tubercle, and a ridge passes forwards and laterally. The ridge is trapezoid ridge. Now coming to medial 2/3 of the shaft of clavicle. The medial 2/3 of shaft of clavicle, which is convex forward. It consists of four surfaces: anterior surface, posterior surface, superior surface, and an inferior surface. And at the inferior surface, there is a groove. The groove is the subclavian groove. And at the junction of medial 2/3 and lateral 1/3 at the inferior surface, there is a nutrient foramina. And the medial end, which is large and quadrangular, it is sternal end, and the lateral end, which is flattened, and this lateral end, which is going to articulate with the acromial process. Now coming to the attachment of the clavicle. The lateral 1/3, it consists of two borders and two surfaces. The anterior border, which is concave forward, which is meant for the origin of the deltoid. This is posterior border, which is meant for the insertion of trapezius. The superior border, which is subcutaneous throughout. And at the inferior surface, there is a tubercle. The tubercle is corner tubercle, and the ridge that passes forwards and laterally up to the lateral end. The ridge is trapezoid ridge. The corner tubercle and the trapezoid ridge, which is meant for the attachment of conoid and trapezoid part of the corticoclavicular ligament. Coming to the medial 2/3 of the shaft of clavicle, it consists of four surfaces: the anterior surface, which is meant for origin of the pectoralis major; superior surface, which is meant for the origin of the clavicular head of the Sternocleidomastoid. This is posterior surface. The posterior surface, which is meant for the attachment of the sternohyoid. And at the inferior surface, there is a groove. The groove is subclavian groove, and at the subclavian groove, the muscle attached is subclavius muscle, and on the margins of the subclavius muscle, the clavipectoral fascia is attached. And near to the junction of medial 2/3 and lateral 1/3, there is a nutrient foramina. And this nutrient foramina, which transmit a branch from the suprascapular artery.